It'll have a severe impact. I mean, this is not just an abstract diplomatic decision. It really will particularly weaken global as well as U.S. health security.
The United States has officially left the World Health Organization. A year ago, Donald Trump signed an executive order criticizing it for being too China-centric, I'm quoting here, during the pandemic. Well, let's remind ourselves what he said this time last year in the Oval Office.
What is this one?
Withdrawing from the World Health Organization, sir?
Ooh, that's a big one. So we paid $500 million to World Health when I was here, and I terminated it. China, with 1.4 billion people, we have 350 to pay. Nobody knows what we have because so many people came in illegally, but let's say we have 325. They had 1.4 billion. They were paying 39 million, we were paying 500 million. It seemed a little unfair to me. So that wasn't the reason, but I dropped out. They offered me to come back for 39 million. In theory, it should be less than that, but, you know. And when Biden came back, they came back for 500 million. He knew that you could have come back for 39 million. They wanted us back so badly, so we'll see what happens.
Now, the World Health Organization has rejected all these claims. Well, let's welcome to the show Dr. Paul Spiegel, director of the John Hopkins Center for Humanitarian Health. Doctor, good afternoon. Thanks for joining us.
Thank you for having me.
WHO Director General has said the withdrawal is a loss for the US and for the world. What impact is the US withdrawal from the WHO? What impact will it have?
It'll have a severe impact. I mean, this is not just an abstract diplomatic decision. It really will particularly weaken global as well as U.S. health security. You know, for example, WHO runs the only true global disease surveillance and alert system, which is hugely important for outbreaks and future pandemics. The U.S., in particular the Centers for Disease Control, was very much involved in this. So the U.S. withdrawal will reduce information sharing and technical coordination, and it will ultimately delay outbreak detection, which will likely mean more deaths and higher economic costs for the world and also the United States.
Now, the US said that the WHO was no longer focused on its core mission. What do you make of that statement?
It's as with everything or many things that the administration says, there is a kernel of truth, but it's often misleading. Mm-hmm. So the WHO, I think WHO and the world and the UN in general needs to really refocus on core missions. It needs to be more efficient and it needs to be more effective. And so WHO's core mission, which has not changed, is surveillance, disease surveillance primarily, establishing standards, coordination, and emergency response and technical sustenance for low and middle income countries. But the world has changed. You know, we have now the pandemic, but climate change, increasing conflicts and displacement and misinformation. And so there has been mission drift, number one. But number two, and we may discuss this, the WHO and most UN agencies really are dependent upon their member states. And so how WHO is funded, what member states tell WHO to do, really affects how WHO responds. And so it's a mixture of both, I think, WHO losing some of its core mission, but also how the member states fund it and tell it what to do.
Is that at the crux of it, though, Doctor? The idea that people, I mean, that's the crux of most things. That if you're going to be receiving money from organizations or from countries, and that gives them leverage in the direction that an organization like the WHO takes, then that is a problem. So do we know if any of Donald Trump's claims are true when it comes to who is the biggest funder of the WHO?
Yes. And I mean, firstly, we have to really discuss how WHO is funded because it can be confusing. There are assessed contributions of which each member state, each country provides. Mm-hmm. And that, as I heard the clip that you played, it's not according to population size. It's a number of primarily financial measures, mostly GDP. as well as the amount of debts that countries have. And so the US is the largest contributor in terms of assessed contributions. But actually, that's only, and this is a problem, that's only around 13 to 15% of WHO's core budget. The problem is most of WHO's budget is earmarked funding that are voluntary. And that's over 80% of WHO's funding. And the US is the largest contributor, it's true, to that. So, for example, I have some of the numbers in 22-23. The US had 218 million in assessed contributions, but well over $1 billion in voluntary earmarked funding. And that was the United States' choice to give that. And it made a big difference because they do have influence. So while historically the WHO's largest contributor is the United States, it has never funded the majority of WHO's budget.
So just finally, with this withdrawal of funds, are there going to be specific countries that are particularly going to be impacted by this?
Absolutely, and it's already started. It's not just the funding that the U.S. will not be providing to WHO, but also the dramatic reduction in overall global health and humanitarian funding, not just by the U.S. but the U.K. and others as well. So the people in the countries that are going to suffer most are going to be the low and middle income countries, and particularly those suffering from humanitarian conflicts. And what this is going to mean is that WHO will not be able to provide the technical support, the surveillance, some of the materials that they often provide. So it's likely there are going to be fewer vaccinations, slower outbreak response, and there'll be greater regional spread in these countries. And who will suffer? It's clearly going to be the children, women, pregnant women, elderly, those that have chronic diseases. So that's number one. The most vulnerable are going to suffer, but so will the United States. It's not just going to be that the United States is going to be in the same position. They're not going to be part of these broad global coordination bodies. And so the U.S. is the world's security, health security, but also the U.S. security is much more at risk now than it ever has been.
Doctor, thank you for your time. I really appreciate it. Dr. Paul Spiegel, there, Director of the John Hopkins Center for Humanitarian Health.